Good afternoon, good morning, good evening, ladies and gentlemen. This is a very, very exciting day for all of us. We are so happy that you're slowly trickling in to join us on this excited, auspicious occasion on the WMI Online Academy pitch presentation. I would just like to acknowledge some of the members who are joining us today. We have the recent WMI supported university alumni and graduates. Karibuni sana. We say that in Kiswahili. Welcome. Thank you so much for joining us. We also have our esteemed and distinguished, ever busy board members, WMI board members. I can see we have Lisa, we have Nicole, we have Ernest. Thank you so much, and all the rest for creating your time to join us today. Then we also have the WMI staff who joined us also after rigorous preparations before COVID, before they planned for a physical, now it's virtual. I'm sure it's such a relief to see that today has finally come. And then we cannot also forget the WMI Online Academy facilitators who've taken through our scholars for the last 7 weeks. Kudos to you all for all the hard work that you put through these 7 weeks. Without much further ado, I'd like to pass it over to Ines, who's our moderator for today, to take us through the program. Ines, over to you.
Thank you, Salome. Again, we welcome everyone. Before I welcome the Executive Director to give a warm welcome, just to also mention that we will be, of course, we've had acknowledgement from Salome. We will be hearing a welcome remarks by Mrs. Jordan Wells, and then thereafter we'll share the ground rules, of the pitches today. That is the main reason why we are all here today. We want to hear what our scholars have been learning for the last 7 good weeks, putting together in form of making a pitch, and we'll be taking you through, that process. Thereafter, we will be doing the voting. This is not just the presentation. We have an opportunity for all of us, who are joining this call, having listened to the various pitches, to have our voice, and you will be having your voice through voting, and thereafter we will have an opportunity where judges will be giving their remarks, and we thereafter, therefore, will be also welcoming, Ms. Nicole, who will be taking us through the next step. So at this point, allow me to welcome the Executive Director, WMI, Ms. Jordan Wells, to give her remarks and introduce the key guys on this platform. Mrs. Jordan.
Thank you, Ines and Salome, for leading this session this past week. I am excited. So I just want to give a little background. We have a 13-member board that helps kind of oversee WMI. It's technically US based, but as you'll see when our 3 board members introduce themselves, that we have board members that are throughout the world. And they've been part of an academy committee helping us in some of kind of our early planning stages and helping us think through the online academy. So we're very excited for them to join. And we're also very thankful for all of you that have participated in the online academy for the last 8 weeks. And that this culmination of having 12 of you pitch your ideas, I think is really exciting, and I'm excited to hear all of your ideas. So I'm going to, without further ado, because I know we have a lot packed in for the next hour and a half, is I want our 3 board members to introduce themselves. So I'm just going to call on you. Gwanael, can you start and introduce yourself?
Yes, thank you very much, Jordan, for the presentation, and thank you everyone to participate in such a great adventure. Such a great beginning of the academy. That is a new chapter, which I welcomed very much. I am the General Secretary of the YMCA of Haiti. I've been on the World's Mountain Initiative since their inception, since their conception, and I'm very glad and happy to serve. I'm also very glad to be on the Academy and to see if we can shape the future with our youth. As you know, the YMCA is mainly youth concerned, so I'm very, very happy and to be here. And I hope that our session today would be very successful for the youth.
Great, thank you, Gwenaëlle. Ernie, can you introduce yourself?
Hello, everyone. My name is Ernie Lamore, and I am the president and CEO of the Rigid YMCA here in the United States, located in New Jersey. I've been a board member of WMI now a little over 3 years, and I'm passionate about the work and love the work that WMI does in helping the scholars around the world. And so I am excited and looking forward to hearing more from you all today in terms of what you're trying to do to help grow and build community around the world. So thank you.
Thank you. And our last board member that's joining for today is DDA, and some of you may recognize him from the Dream Big conference in Uganda. So he's joining us. So if you can introduce yourself for those that didn't meet you there.
Yeah, as you mentioned, I was there at the Dream Big conference 4 years ago. I met maybe some of you. So I'm Didier from Brussels, Belgium in Europe. And also right after the Dream Big conference, I joined the WMI board, and I'm now the chairman of the Academy board. Good luck to everyone. Thank you.
Great. Well, thank you for all of our board members that are joining us, for our staff, for Ines and Salome for running this whole session this past week. I am going to hand it over to Ines to go through the ground rules and presentation, and then we'll get started with the pitches. So good luck, everyone.
Thank you. Thank you very, 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 very much. Thank you. Thank you, Ms. Jordan Wells, for introducing the board members, setting the stage in terms of the background, and just getting us here. Again, I take this opportunity to welcome you all, to this great moment. We can't wait to hear, the ideas, that will be coming, from our scholars. A few ground rules. Number one, all our presenters will be having the ability basically to make presentations. At the point of you making presentations, please ensure that you have your video on. We hope that you'll be able to project, unless otherwise we'll be hoping, for all the presenters to have their video on. At the point of presentation, you will be the only one, that will be having your video on for all of us and the participants to give you that visibility, that you did. We expect all of us to be muted, except for the presenters, so that now we eliminate any possible, noise, that would be tend to be disruptive. Allow me to mention that the presentation can take any form, as we've been talking about this, could be orally made, could have, PowerPoint, whichever preparation you've done, we are looking forward to that, that presentation. In terms of time, all presenters have a maximum, of 5 minutes, a maximum of 5 minutes. If you can finish your presentation in 3 minutes, even the better. You have a maximum of 5 minutes to put your case. You're not just putting your case to the judges, but you're putting your case to your colleague scholars, you are putting your case to your colleague presenters, and you're putting your case to WMI, academy community. So we are all looking forward to you putting that case, in the best way you know how, between 3 to 5 minutes, maximum of 5 minutes. We also recognize that there may be a chance, that due to maybe connectivity challenges, you may be able to drop off the call. If you happen to drop off the call at the point of presentation, you'll have a maximum of 1 minute to join. If 1 minute lapses, you will be able to be rated, until that point when you drop off. So just wanted to make that clear, that you'll have a maximum of 1 minute to return to the call. when you log off for unclear circumstances. So I just wanted to make that clear. In terms of the order of presentations, we will be having our first presenter, All Things Fertility by Onesai will go first, and it will follow that order. And then secondly, we'll have Heritage. Then there will be the Nicholas Health, that will be third. True Pharmacy Health will be presented as we have the fourth, which is Sad Ventures, and then the fifth will be True Pharmacy Health. The sixth will be Youth Engage. The seventh will be Community Growth Foundation. Please note the order. The eighth will be eHealth. The ninth will be Family and Communication Trusts International. The 10th will be Possible Groups. The 11th will be Postnatal Mental Health Society of Botswana. And then the 12th will be the Second Chance. That will be the order of the presentation. Of course, I'll be prompting, the presenters as they come along. So if we are all set, ladies and gentlemen, allow me to welcome our first presenter, All Things Possible, to take the forum, and have, the presentation now. So All Things Fertility, this is your chance. Thank you.
Thank you. Good afternoon, good evening, good morning. Unfortunately, my network is unstable, so I cannot project my video and the slides concurrently. I will present my video after I'm done with the presentation. Okay. Welcome to the looking glass of my business of making babies, all things fertility. I'm Onesai Chifuwe, sole business owner of a limited liability company and an infertility specialist medical doctor, who estimates that globally a shocking increase in 186 million individuals suffer from infertility, causing Zimbabwe being increased in sexually transmitted infections and teenage unprotected sexual intercourse. Working in obstetrics and gynecology, I witnessed the debilitating effects of infertility with denied access to treatment due to lack of funds and high treatment costs. Women in low and middle income countries are disproportionately affected by infertility, both in lack of access to treatment and stigma. Men too are victims of that same stigma, which emasculates and perpetuates infidelity. I watched my maternal aunt go through the shame, stigma, and ridicule of being infertile, riddled with desperation and saddled with the responsibility of being the causal factor, as many infertile women are. Her experience inspired me to start this business and ensure it is a success, as it addresses a problem with the greatest impact on women. Due to limited access points, the business primary location is in Mutare. Our mission is to provide an expert quality, affordable, efficient infertility management service through a synergistic system which will see those that suffer from infertility and can afford the service cost, pay for the infertile who cannot cover the cost of service, a principle of barter exchange. I tested this innovation by administering a questionnaire to infertile couples. 86% of those who responded were amenable to the solution. Our vision is to become the leading, affordable, efficient infertility management, non-discriminatory, non-judgmental, diverse C corporation. Infertility is not recognized as a disease. Thus, there is lack of quality, affordable, and equitable access and decentralization of services. Also nowadays, women are highly career-driven and live in childbearing until later in life. We are targeting self-pay customers, including those that cannot cover the cost completely, and those with health insurance cover, inclusive of single women, heterosexual, infertile couples, and health management organizations. In line with the business vision, we aim for a greater than 60% reach in 5 years and a substantial and tangible impact within 10 years. Our goals and objectives are as highlighted. Our service offering includes egg and sperm donor services, egg and sperm preservation, genetic testing and artificial reproductive techniques. Sample collection, result collection, and transportation will be done in-house. Our SWOT analysis is as shown. And our biggest threat is the economic instability that is prevalent in Zimbabwe. This will be mitigated through accounting for inflation and tax fluctuations. In line with international best practices, the team is as highlighted. There will be a profit sharing arrangement, which will be performance-based and subject to review. Currently, few job descriptions and titles exist and available are too many hat-wearing, non-paid employees. Our marketing plan is as shown. We are currently networking, innovating, selling of services, market testing with surveys, and a pilot version of our offerings, implementing ideas and minimal processes, business model tweaking according to the market and profitability. Our monitoring and evaluation will include standard operating procedures, which will standardize the service, as well as all the others that are detailed on the slide. Statistics show $1 billion industry worth and an estimated growth rate of 4.2% over 5 years. The startup and operational costs for fiscal year $180,000 with a target of $75,000 sales and an annual 5% profit. Income generation from every legal means within the scope of our industry will okay. Our capital investment will be through a limited liability company cash advance, which has the limited liability company has a risk of automatic dissolution, which will be mitigated through an operating agreement clearly outlining roles and responsibilities. Resource requirements are not limited to business registration fees and consultancy, license and permit legal costs. The next steps for our business, we want growth through referrals and new customers with modest price increases, business survival of its own cash flow, focus on team building and hiring higher level people to run operations, investment into operational growth through giving back, profitability, and equity. Our success story has been the successful treatment of a couple with first trimester recurrent miscarriages. And they are currently in their third trimester of pregnancy, a highlight of our business to date, given we've only been operational for a little over 10 months. Thank you for listening.
Thank you very much. And without further ado, allow me, oh, what a video, you know, it's also an opportunity to see your face. So thanks for that. And thank you for your presentation. So allow me to welcome the next presenter, that is Heritage, you know, to take the stage. Do we have Heritage? Heritage going once?
So this is Jesse. Jesse, you have just been promoted to a panelist with the second account in which you're signed in on.
Jesse?
Hi, good afternoon, everyone.
Good afternoon, please proceed.
Hi, thank you so much, and sorry for the delay, my light and other internet issues. My name is Desmond Jesment Wood, and I am a WMI scholar from Accra, Ghana. And today I would like to walk you through my innovative business idea. Over the past few months, over the past few years, we've had a lot of people moving from rural areas to urban areas in Ghana in search of jobs. And this has led to the creating of other problems in the urban area. One of them mainly being the heavy traffics in town. According to the Ghana Transport Unit, an individual will spend on an average 3 hours in traffic before getting to work. That is one part of the problem. The second part of the problem, because people want to avoid this traffic, they tend to leave the house very early in order to get to work, hence forgoing the most important meal of the day, which is their breakfast. And that is where Heritage comes in. Heritage is a breakfast and beverage business that is looking at providing the daily Ghanaian on the go who didn't have time for their meal an affordable and portable breakfast.
Jessica, can you hear us? I think we've lost Jesse. Probably we give Jesse an opportunity to be able to come back in about a minute. Thank you, colleagues. We are unable to get back Jesse on time. I think because of connectivity issues, but as per the rules, allow me to move to the next presenter, and we will have Nicholas Health Plus make the next presentation. So if you're ready, Silas.
Yes, good afternoon, good morning, and good evening, depending on where you are. I'm Dr. Silas Annan, and then I'm presenting from Ghana, Takwa, Nicholas, a business pitch. Please, I guess I'm heard. Hello, can I be heard?
We can hear you.
Yeah, okay.
We can hear you. Please proceed.
Yeah, so I'll start with a short scenario. A 10-year patient, a 10-year-old pupil, class 6 pupil, was rushed into the emergency with complaints of sudden collapse and unconsciousness of about 20 minutes duration, and then 3 days history of vomiting and then diarrhea and temperature and fever. 5 minutes prior to the unconsciousness, this child was seen convulsing. So clinical and then clinical assessment indicated this patient this child has severe malaria and then presumed sepsis. So we started management. Apparently she came unconscious. By 8 hours, this child was still unconscious. By 12 hours, she had regained consciousness, but then she was lethargic and then she could only speak few words. We managed this child for about 3 days, and then she started walking and then being active. But on the first day of admission, they ran some kidney function tests, and you noticed there were abnormal kidney function results. So we assumed the lady had a complication the child had a complication from the condition. That is, so on the 3rd day, on the 4th day, we referred this child to a nephrologist for assessment, further assessment, and then management. So that's the short scenario. Introduction, I'm Silas Annan Kakaba from Ghana, and then I'm doing a business pitch on Nicholas. Nicholas is a business which was established by 2 people from different backgrounds or professional background. And then the name is gotten from the first names connected. So my other compatriot is Michael Adedina, and then I am Silas. Michael is a chartered accountant, and then he is also practicing. I'm a medical doctor. Apparently, Nicholas was a later formulation. The initial thing was there was a problem in the society, which I'm currently reviewing papers from Journal of Patient Experience. And then I noticed that that has been a global issue of the 3 delays where patients have delays in seeking help. And then it's a global health or public health importance And currently, a fourth delay has been found. That is the delay by the health professionals to even send a patient for further assessment. So the problem was the delay. The first delay is the delay in making decision to seek help. And then the second one is the delay in transportation. Even though you made a decision to seek help, the second delay is now the means of transportation to the nearby facility or a higher facility. And then the third delay is the delay patients even encounter at the health facility. So we as MECLAS noticed that there is a problem we can help. So the vision we had was to bridge or to close the gap or to eliminate these delays into the barest minimum. So we decided to do that by setting up clinics or facilities in the closer to the doors of people who would need our services. So our targeted population was school pupils. That's below those from nursery, kindergarten, from kindergarten to JSS 3, and then not above the JSS level. So what we do is we send submissions or letters to schools, basic schools, and seek the directives or consent of headmasters and then the direct board of directors to give us permission to set up a small clinic in their facility. And then they will give us the space, we provide the beds and then the other logistics. And they will pay just like a student health insurance policy. They will pay small amounts. And then the amount they will pay, they would have a seeding amount of about 2,000. So 2,000 cedis, Ghana cedis, sorry. That means if a child is paying $5 every 3 months and then fall sick, the MECLAS will provide health of a seeding amount of about 2,000. And then we started doing that. We currently have about 3 schools, and then the 3 schools, we have 108 subscribers to that. Our short-term goals has been, because initially it was just about bringing health to the doors of these patients, we named it a SHIP, which is Student Health Insurance Policy. But now, after advocating and an advertisement, we also noticed some people who would want us to be at their doors and then provide health. That is the home care thing. So we have what we call the Dr. Door, which is something currently we are trying to set it up. And then we are getting people also enrolling, more people enrolling on that. Our long-term services is that because we are living in a mining community, a lot of people have subscribed to their private health insurance and therefore would want their services sent to their subscribed facilities, not on MECLAS. So what we do is we want to have what we call PPAG, that's Planned Parenthood Association of Ghana. And then it has been in existence, and we decided to bring this thing on board in the sense that a lot of patients we see on day-to-day basis, a lot of couples want what we call, they are struggling for, or infertility issues. They are struggling to have kids. And because they have facilities which mining sectors they are sent to, these guys are not able to get that needed fertility consult they get. So PPAG, which is a future plan, is just to also create a platform in where we can, people who don't want to carry their pregnancies, or couples who do not wants to carry their pregnancies, can by law legally give their unwanted pregnancy to another. That's something we are thinking along on, which is a future plan we want to establish. And then our weaknesses, we have staff.
Salas, you have 1 minute to wind up.
Okay. Yes, our staffs are not permanent. We have a nursing, we have 3 nurses in the 3 facilities, but they are not permanent. So, and after 3-4 months, they will be posted, meaning we need to get permanent people to replace. And then opportunities, we stand a chance. We are the first and then the only group or team that has come out with this MICLAS or the student health insurance policy. So we stand a chance of expanding across all the region, the whole region of Western region of Ghana. And then the basic trait is where to also store our drugs currently is an issue. We are working on it. Resources, the accountants, the other CEO, my co-partner is the accountant. He plays the role of the accountant in the taxes of the business and then monetary issues. And then I'm the medical doctor. We have 3 nurses, as I said, and then we had a PRO and another stuff which we are currently looking into. We want to expand our business across like the Takwa, where we currently are located, to the other regions. So we wish to get more opportunities or more resources to do that. Thank you.
Thank you very much. Silas, much appreciated. I just want to place another announcement to all the presenters that time management is still part of the assessment of the pitches, and I do encourage presenters to stick within the 5 limit timeline. Thank you very much. At this point, allow me to welcome our next presenter, Sad Ventures, to take the floor. Sad Ventures.
Good morning. Hey, no, sorry. Good evening from Uganda. My name is Flavia Nabagereka. I'm a pharmacy technician by profession with 4 years experience and a procurement supply chain specialist with experience of 2 years in that field, and pharmacy management with an experience of 2 years. Apologies, I'm in a kind of a busy place. So if you hear any sounds, kindly forgive me for the sound interruptions, but I hope my voice will be above the noise. I'm here to interest you with an idea of true pharmacy help. True pharmacy help is an idea that was coined back in 2018, and it is along the line of offering pharmaceutical care, which is community-based. Ever thought of a pharmacy which does not offer prescription refills? Well, that is true pharmacy help. True pharmacy help will be a pharmacy that doesn't fill out prescription, and it will be dealing with community-based pharmaceutical care. Along the way, you'll hear about our service mix. And our mission statement will be to improve the lives and wellness of everyone we serve by providing safe and affordable medicines, over-the-counter medicines, through strategic partnerships and advocacy for better preventive health care of the community. So from our mission statement, we point out our core values, and we shall be basing all our work and service on these 5 core values, which is innovativeness, advocacy for better health care, and especially preventive health care, as you'll hear later on in our objectives, partnerships with other health workers and our competitor pharmacies in the same industry, customer eccentricity. We are working on having, being flexible, giving the customer what they want, the affordable service and flexibility in terms of delivery and other terms. And just like the name says, truth. Those are our core values. And when you talk about community-based care, currently in the location where I stay, where True Farmers will also be located, that is in a village, a remote village called Chisimbili, Wakiso district in Kampala, Uganda. We are having a total of around 5 pharmacies with about 10 medical centers and hospitals. And all these are focused on offering medicine, filling out prescriptions, which doesn't divulge deeper into the responsibilities or the whole idea of pharmaceutical care. In pharmaceutical care, we are looking at going beyond offering prescriptions, refills, to actually going beyond the monetary relationships to looking after your patients through different ways, which will be offered by True Pharmaceutical Care, as we shall see later on. Our problem that is currently, that's True Pharmacy Help has come in to solve is we are looking at offering preventive health care. And looking at preventive health care, we are looking at water, sanitation, and hygiene, and counseling, and offering support.
Flavia, can you hear us? We lost you. Flavia, can you hear us? You have lost Flavia, so we are giving her a minute to see if she can rejoin, because she was almost. We really hope that her network gets back, because she was almost done with the presentation. I think she had gone about 90% into that presentation. Okay, thank you very much. I think we need to move to the next presenter. And I think judges have a better insight given how far the presentation had gone. And at this point, allow me to go back to the 4th presenter, SAD Ventures, to make the presentation. The one that I just presented is presenter number 5, that is True Pharmacy Help by Flavia. So you're back to the 4th presentation, SAD Ventures by SAD. The floor is yours. SAD, I can see you are on the panel side as presenter number 4. Please, you can proceed with the presentation. Sad, can you hear us? Okay, we can move to the sixth presentation. The sixth presenter, Youth Engaged in Apitherapy Limited. Please, the floor is yours.
Hello.
Hello.
Yes. Good day. I'm Nyoyita Bonaventure, a WMI graduate scholar based in Rwanda. Do you know that in Rwanda we have 89,000 beekeepers, but only 45% are active? Do you know that Rwanda is allowed to export honey directly into the European market? I'm Bonaventure Nyoyita, founder and CEO of Youth Engaged in Apitherapy, which is a business founded with an ethos of transforming unproductive and non-beneficial traditional beekeeping to productive and beneficial modern beekeeping. Our progress has been started in 2017 with an ethos of transforming traditional beekeeping and helping traditional beekeepers to move to modern beekeeping. So we are currently having our modern own bee farm. We have a well-established team, and we are already making products and selling our products. So selling affordable, durable, and affordable natural honey is our strength. And our government is supporting us currently because we have got a free bee farm from the government, and the climate change, mainly during the rainy season, is our main challenge, which is hindering us sometimes to get a loss in that rainy season. But we are trying to figure it out through the different solutions. So the problem, the Rwandans have been doing traditional beekeeping, but with small production, and they lack processing machines, which are able to produce direct honey for being consumed. So we are bringing on the table a natural and beneficial modern beekeeping, which provides good honey and cosmetics, including waxes and oil, and also soaps. Lacking of enough capital and staff is one of our weakness, and our profit mainly comes from selling our own honey, beeswaxes, and cosmetics. And we are having a target market of 60% of Rwandans who are living in the south of Rwanda, in which we already have 25% of them. And our customers in a year are about 300 and 500 clients every year, including different supermarkets. Our market opportunity is ranged between 1,200 and 2,500 USD. And we are currently targeting customers from the south of Rwanda with a target of 1,500 customers per year. We are using ambassadors in marketing strategy and branding. We are using social medias, Facebook, WhatsApp, and Instagram. We are also using month to month. We are having our main kiosk and small kiosks. We have twinned with different supermarkets, and we are using a B2B strategy in the marketing. Kamonyi Association of Beekeepers and local beekeepers are our main competitors. Households, individual consumers, supermarkets are our main potential customers for our products. We are currently in need of 3 technical staff members with experience in beekeeping. We need more modern beehives to expand our farm. We need processing machines which can help us to make food for bees during the rainy season. Our team is made by I, Bonaventure Nyoyita, founder and CEO. We have Mtimuche Clarisse, finance manager. We have Dr. Gerard Hagenman, human resource officer. and we have Semangenzile Onad, who is our field technician and our veterinary. In our achievements and funding, we have 20 modern beehives producing 350 kg per year. We have been selected as the third best young innovators of the year by These Numbers Have Faces, which is a UK-based NGO, and we have been founded with the Ministry of Youth. We have been written in newspapers, including New Times Rwanda, and we have signed a memorandum of understanding with Association Rwandaise pour le Développement Intègre. Our goals and future plans, we want to optimize our profit by increasing our production capacity from 350 kg of honey to 500 kg of honey by the end of 2021, which will shift our income from 1,500 USD to 2,100 USD in 2 years. We want to increase our market size by 30% by serving more than 8 supermarkets in Kigali. We want to empower our tiered mentorship program and to help us to empower and inspire more than 250 youth about entrepreneurship and working in a cooperative in the Kamonyi district. We want to be the main honey supplier of honey in the south of Rwanda. And so thank you so much. This was my presentation.
Thank you very much, Bonaventure, for the presentation, and fantastic job in relations to time management. We will be moving to the next presenter. That is presentation number 7 on Community Growth Foundation, and I welcome Abdul to make his presentation. Abdul, can you hear us? Abdul? Is presenter number 4 ready? Sad. Sad, are you able to present?
Yes, please.
Sad,
yes, please.
Are you able to present now, Sad?
Yes, please. Can you hear me?
Yes, we can hear you.
Hello. Yeah.
Yes, please proceed with the presentation.
My name is Asan Singh, and I'll present on the business model, and the name of the business is Adventure. The name of the business is Adventure, and our teaching for the business start. The business Adventure is a business that's an idea that have created to help people who usually help people who have chronic medical conditions and they require special diets. And
hello, Sad.
The mission is to provide.
Hello, Sad. Can you hear me?
Yes, please. Can you hear me?
Yes, we're struggling to hear you.
Yes, I can.
We are struggling to hear you, so if you could, we can reschedule your presentation, while you sort out the connectivity issue, and then we welcome another presenter, because again, we are getting feedback from the audience that they are unable to hear you clearly. We have Community Growth Foundation. Abdul, are you ready?
Good afternoon.
We can hear you, Abdul. Please proceed.
Yeah, good afternoon, West Mountain Initiative. I'm Abdul Kuruman, founder, Community Growth Foundation. Let me start by introducing briefly my organizations, community growth foundations, which actually started in 2020 with the aim to create and promote community structures that bring vulnerable and underprivileged individuals access to how healthy communities are created and poverty overcome, with a vision to become one of the leading charity groups in the fight to overcome health and educational inequalities and poverty. Because our mission as an organization is to create and strengthen communities where every individual has equal opportunity to live in a healthy and sustainable society through health promotion, education and gender equality, community empowerment and development. In our current operations, we have been able to identify a need assessment that is focusing on addressing community access, lack of community access to water, sanitation, and hygiene facilities. After we've discovered, we find out from a need assessment we conducted that 2.9 million people do not have clean water, meaning access to clean water in Sierra Leone, with also 6.7 million people without decent toilet facilities, with also 725 children under 5 dying every year from diarrhea, with further evidences from the Ministry of Water Resources in their report, which actually captured that 27% of the populations in urban areas have access to basic sanitation compared to 8% of the populations in remote areas. Across Sierra Leone, with only 5% of the populations have access to all 3 wash facilities that include water, sanitation, and hygiene facilities. With the need assessment just described, we have been able to come up with a goal and objective. Goal as our long-term, and also we have our short-term objective. We have 2 objectives, actually. My interventions, my organization currently is working to achieve. 1, we are working to ensuring that project communities have access to improved water sources and other income-generating sources to expand adequate access to water facilities. Another short-term objective is also interventions communities have access to sustainably managed and village savings and loan associations-based microfinance services, self-mobilized revenue to invest and sustain water facilities, with our long-term goal of ensuring that we ensure deprived communities have increased access to water, sanitation, and hygiene facilities for dignified and healthy lives through the constructions of low-cost but improved water facilities, integrations of livelihood sources, creations of village savings and loan associations, provisions of business skills and opportunity, community empowerment, community-based and strengthening of project communities, and sustainably managed water self-supply system. Our program focuses on 3 thematic areas. 1 is education and gender equality, health promotion, and community empowerment and development. Our unique features as an organization, we are challenging affected communities to take active part in the creation of healthy and sustainable society by triggering them to lead on the mobilizations of community resources and invest into water facilities. Another unique feature is creation of services with social, financial, and technical sustainability, all within the beneficiary community. Our SWOT analysis. Our strengths as an organization, we experience in identifying and designing sustainable community engagement projects, the ability to design low-cost projects with greater impact. Weaknesses, we have limited funding, lack of mobilities, hard to reach and connect with far communities. And threats, poor stakeholder selections and analysis. We have government health regulations due to charges that has to do with water testing. They will also have opportunity, large community-based support, abilities of communities to create greater impact from small grants, High-cost model water points constructed by NGOs are not easily managed by remote communities. So our threat mitigation strategies, we are working on improving the need assessment and stakeholder analysis, also create and strengthen partnership for active stakeholders involvement, inclusions of national-based stakeholders in our design and implementation. As an organization, we have our structure. We have board of directors with 4 people currently who are actually acting to provide strategic and advice and input. We have myself as the founder and program lead. Also have the program coordinator. We have finance, so HR. We have monitoring and evaluation officer. We have communication officer. We have field mobilizers, and we have community volunteers. Marketing strategies. One, we are raising awareness of communities on them.
You have 1 minute to finalize. 1 minute to finalize.
We focus on village savings and loan association, establishment of a savings group with progress of beneficiary to have mobilized over $1,000 from also $1,000 last year. We actually received from a West Mountain Initiative. So I'm happy to announce that my community currently have been able to mobilize over a $1,000 grant again. Our M&E strategies actually, we are also, we have a very good monitoring and evaluation system in place to ensure that we are able to actually report and give feedback to our stakeholders in terms of the impact we are making, in terms of mobilizing resources by our project communities. Of course, our budgets and financial plans and risk management, and we are actually planning to expand our initiative next year to another communities where we are also seeking a grant up to $34,574 with an expected revenue mobilizations of also again $7,000 to be paid as a sort of a conditional grant by the project communities. Thank you all for listening.
Thank you, Bill. Much appreciated. At this point, allow me to move to the next presentation, e-health. That is Yusta, if you're ready. Is e-health ready? So if e-health is total, can I request everybody to have their mics off? All right. E-health, if you're ready, you can take the floor. Can we have Family and Communication Trust International, Clifton, to take the floor?
Thank you so much. Allow me to share my screen.
Hello. Hello, everyone.
Hello, can we have Clifton to make a presentation? Then we'll come to you later. Thanks.
Okay, thank you.
Thank you very much. So Clifton, over to you.
Thank you so much, my name is Clifton Chifuwe, and I am coming from Zambia. The name of the organization I'm representing is Families and Communications Trust International. We are located in Garden House compound off Mungi Road in Lusaka. And those are my contact details there. Basically, the background of our organization is actually one that is of a non-governmental, not-for-profit, not partisan. And it was just formed this year in June. And primarily because me and a colleague of mine, we had the privilege to attend or do our attachments or internship at one of the refugee camps in Zambia called Meheba. So this is how this idea of forming this organization actually got started out of our experience there. So our mission statement as an organization is actually to change conflict-prone culture among refugees into culture rooted in peace through mediation and peace building as keys to preventing and resolving conflicts. You will understand that from our experience, we actually witnessed a number of conflicts that happen within the refugee camp, and because of that, we thought this is a gap that we need to bridge. And because of that need, there is actually a great need that exists in our country and maybe the world over for a comprehensive and coordinated approach to preventing and resolving violent conflicts among refugees. So what we learned from Meheba is that there is no laid down conflict resolution mechanisms. Then there's no post-conflict trauma centers. The person that we found working as a counselor to refugees, which for us, we saw it as something inadequate, is somebody who was just trained in psychosocial counseling, which is quite different from what we went through as conflict experts. And there's also increased child marriages, and we hope that through our intervention, we are going to reduce or decrease this, because in itself, it's also a conflict issue. And then there's inadequate security. We hope that we can advocate for that. In terms of our goals and objectives, the short term is to bring sustainable peace and unity into 3 refugee camps by reinforcing the capacities of societies to overcome entrenched divisions and to address conflict using non-violent methods by the end of December 2023. And then our long-term objective or goal is to actually strengthen the capacities of these refugee societies so that they are able to manage conflict by using non-violent methods. And this will do by supporting the nation and international, which is now UNHCR, actors in their efforts to develop social cohesion among refugees. So our niche is probably specifically advocacy. What we also learned through our experience is that there are actually no evidence-based peace building legislation policies that actually enhance the capacity that will then trickle down to reduce conflicts among refugees. Our experience, I think the period we were there for 2 months, we experienced over 30 incidences of violence, and this is amongst themselves as refugees. And as students who were on attachments, this was really concerning to us. These are people that are running out from conflict, and yet when they are grouped to try and get help, they still want to attack each other, and even to the point of killing one another. Some of the activities we envision to do is empowering these refugees towards positive change in their attitudes for coexistence. And we are also going to conduct peace building and peacemaking cycle processes, where these will be continuous learning processes for them so that they can understand the importance of togetherness and peaceful coexistence. And then also mentorship. We are also going to do sponsorship, and this is something we gained strength from Wales Mountain Initiative. And as you notice later, we are going to do this in partnership actually with other organizations. And then we also do post-conflict trauma counseling sessions. And then also we realized there was no documentation of these violence incidences in the data for the Ministry of Home Affairs, which is the host ministry for refugees. And then we are also going to advocate for introduction of French teachers for primary schools. It was very saddening that a majority of these refugees come from Congo, and Congo is a French-speaking country, and children do not go to school because the people that are actually running these schools are teachers from Zambia, and they are unable to speak French. And so many of them do not actually have an opportunity to go to school. And because of this, perhaps this is what leads to them engaging in early sexual activities and getting married early. And then we'll also try to supply them with reusable sanitary pads. In terms of our SWOT analysis, what is our strength? Our strength is partnership. We have already partnered with the Needs Care Foundation, which has agreed to supply reusable sanitary pads. We'll also, just yesterday, I had an opportunity to talk to the CEO of a Great North Rehabilitation Center, who has accepted that they can provide actually these trauma, post-conflict trauma counseling. And the government, of course, is a main partner because they are hosting these refugees. And then WMI, like I mentioned, we want to use this opportunity we have because many of the refugees, once they complete secondary school, they don't have an opportunity to go to tertiary education. Our weakness, we haven't yet registered our organization, and because of that, we see this is a weakness as we are rendered operating illegally. What is our opportunity? We see there's a good political will in Zambia right now, and they would support civil society organization. And then there is also an increasing number of refugees that are actually coming into Zambia. So this gives us an opportunity. What's the threat? We fear that our activities can be rendered illegal and then and then they can ban our organization. In terms of staffing or human resource, currently we have the CEO, who is myself, and a colleague, and then finance officer, and then programs manager, and also program officer. All of us are still acting mainly as volunteers because we do not have funding that really support salaries. And then in terms of marketing and branding, we have already started using the social media and print and electronic media together. And then another aspect that we are strong in, as you might have already seen, is actually networking. We are busy trying to network ourselves with other organizations so that we can have a better visibility. Monitoring and evaluation, we are going to do this at 4 levels.
Clifton, you have 1 minute to finalize, please. 1 minute to finalize.
Okay, thank you. Project impact, project performance, and then we'll do also project impact, mid-term evaluation, and then the final evaluation. So in terms of our budget, we envision to have a budget total of 640,000, as it has been broken down like that. We hope to solicit donor support of 600,000, and in kind, these we just valued them because they are provided by other organizations and what we have sourced ourselves. Thank you so much.
Thank you so much, Clifton. And I think we will move straight to the next presenter. Do we have possible groups ready by Alexander? If you could proceed, please, to make your presentation. We can't hear you. Can you please move closer to the mic? Yusta, this is e-health, yeah?
Yes.
Yeah, so we are getting back to presenter number 8. So this is e-health by Yusta. Please proceed.
Hello, everyone. My name is Yusta, IT specialist. My project is e-health for women. It's a CBO. So e-health for women is youth-led project based in Muhanga district in South Province of Rwanda, designed to help women and young girls living in rural and remote areas with their reproductive health. We are using internet as an enabler to helping young girls and women to track their menstrual cycle, to helping pregnant moms to track the progress of pregnancy and estimate date of delivery. This project also will help us to track and do follow-up for immunization calendar for their children. Our project also will provide connection between women and doctors for advice and guidance. Another service this project will be providing by using mobile application. It will be based on mobile application and website. It's a e-health for women. It's a project that will be based on mobile application and website that will help a woman for this service I talked above. Also, this project will provide training to use that mobile app and website. So, as our mission is to reduce unintended pregnancy, to provide safe motherhood and young infants care among youth and girls in Rwanda, through cost-effective and easy-to-use technology of mobile application and website that allows connection between its user and doctors for overall good sexual and reproductive health. As mentioned, our project will be having mobile app and website. While developing the web, we will use JavaScript as a programming language that will be used to create this project. As I said, it will be an Android. We will be using a computer or we will be using mobile phone and computers, but through you will be having internet. You can connect and you can't access our service without having internet. It means that you will be need to have internet, smartphone or computers in order to access our platform, this project. So this project also will be a connection between women and doctors for advice and guidance about reproductive health information. Also, the women will be allowed to ask guidance, to ask advice through chat box. It will be having a chat box. So according to the case study for this project, according to the research done in Rwanda, 2019, population is in South Province in Muhanga is 57. It's a woman under 25. So it's a high rate of fertility. The teenager pregnancy rate in Rwanda have increased 6 in 2015, and 2020 have increased also 17 mothers in the first pregnancy between ages. Only they meet unintended pregnancy due to the many reasons about not knowing tracking mature cycle, lack of knowledge about the sexual reproductive health, about the inaccessibility of constructive and the reproductive health and care. So the short term, at least 70 by this year, 2021-22, Muhanga women will be encouraged to use technology in our daily life for making easy and getting information easily, especially in reproductive health through e-health for women. Another short term, in 2021, women will know how to use e-health for women app and website for tracking or service are listed above. So women will be inspired to using technology in corners of life, not only on accessing health reproductive information, also will be encouraged to use technology in another corners of life, in e-commerce, in business, in education, or another way. So the long term, in the end of 2020, I plan to extend this project. As I said above, it will be in Muhanga district, but next 2022, I'm planning to extend another district, another project. So moreover, them to make this M for Women app will be accessible online, download the app and find where you can access. So, the product we are providing, as I said, it will be the NIDA to develop app and website. It's the first idea to develop app and website to help with sexual reproductive issues in Rwanda. It's a first project. So this project will look away the customer care, other benefits you leading this project will get that about, like capacity building, building leadership, community mobilization. So the service, as I said, it's developing app and website. We're hosting in the appropriate place. So the skills needed to implement this project.
You have 1 minute to finalize,
yes. Please. Okay. We have a team, project manager, user, another human resource, web developer, test and trainer. So marketing and the planning, of course, as the technology improving every day, we are planning to use social media like Instagram, Facebook, newspaper, and another. So we intend to organize talks, physical talk, radio, television talk, visit some school and university. The following measures are successful. The youngest and women receiving the training about the app every month. And girls and women able to use efficiency WAP 1 month after, and will be making evaluation to see who is actively using MAP 6 months and will be using in 1 year. So as annual business project cost include cost training, advertisement, HR payment, hosting app. Also, it will be as estimating 5 million. So estimate funding, it will be like 1 million. Thank you so much.
Thank you. Thank you very much, Yusta, much appreciated. You know, we have now the opportunity to welcome the possible groups. Alexander, are you here now? If you can stop sharing the screen, Yusta, so that we can give the next presenter an opportunity to present. Alexander, are you here? Do we have Postnatal Mental Health Society of Botswana? Portia?
Yes, I'm here.
Please proceed.
Okay. Hello, everyone. My name is Portia Kyatametse from Botswana, Africa. Thank you for having me. I'm a nurse by profession, a WMI graduate scholar, and I run an NGO called Postnatal Mental Health Society of Botswana, which is an organization that advocates for maternal mental health issues, which has been in existence since the year 2017. It was formed after a personal battle with maternal mental health issues. So I found the need to advocate for these issues after I found the need. Yes. So basically what we do, we disseminate maternal mental health information to women and girls in the pre and postpartum period. We offer free counseling services as well as distribution of free infant and maternity starter packs to those who are in dire need. This is due to the fact that maternal depression is the common complication of childbirth, according to research, which calls for the need for maternal mental health services. So in terms of the prospects of the problem, globally, it is estimated that about 10% of women in the prenatal period and 13% of those in the postpartum period give birth. They do experience a mental health disorder, primarily depression, and this is in accordance to the World Health Organization. In accordance to research has proved that pre- and postnatal depression is much more prevalent in low-middle income countries like Botswana, probably due to less knowledge and resources to tackle these issues. So the need for counseling services in the pre- and postpartum period has escalated with COVID-19 due to the increased isolation cases, and the social status has gone down. So basically, what is our mission? To promote awareness, prevention, hope, and support to women and girls during the pre- and postpartum period through information dissemination, free counseling services, and distribution of infant and maternity starter packs. So what is the opportunity or the need? In my country, Botswana, there is no prominent gateway to address maternal mental health issues, and this has been confirmed by the Ministry of Health, Botswana. And mind you, my organization, Postnatal Mental Health Society of Botswana, is the only NGO in Botswana which advocates for maternal mental health issues. We have other mental health organizations, but they are not specific to this. So mine is the only one that is specific, which shows that there's indeed a need. And also the fact that Ministry of Health Botswana has no prominent gateway to deal with these issues. So there's also an increase in the need for counseling services due to COVID-19. So basically, what do we offer? We offer free counseling services, distribution of infant and maternity starter packs. So who benefits from our services? Girls in the pre and postpartum period and women in the pre and postpartum period. So in terms of success stories, we have been able to counsel over 10,000 women so far since our inception in the year 2017. In terms of monitoring evaluation metrics, we intend to do monthly reports, annual reports, and auditing in order to make sure that we are on the right track. In terms of our sustainability model, we aim at getting the funding from donors. We also aim at holding events in order to raise funds, the sale of goods, merchandise like t-shirts and pens, like that. And marketing plan, we aim to use media coverage like newspapers and television, as well as social media. Human resources, we have volunteers, and I act as the president. I have my vice president, PR, the treasurer, and other support staff who help in the day-to-day activities. So in terms of our short-term objectives, we do daily teachings on maternal mental health issues, daily screenings. We make sure that we have reached at least 50% of women, since our target is 100 every 6 months, to make sure that 100 women are reached with daily teachings, and then maternal mental health screening, referral services and counseling, as well as buying and distribution of those starter packs. Long-term goals, we aim to see healthcare workers being certified in maternal mental health, and also maternal mental health included in the day-to-day maternal and child services. Also, maternal mental health division should be incorporated into the Ministry of Health Botswana, as well as training of healthcare workers. So in terms of the SWOT analysis, we have a strong vision and mission, looking at we are the only niche in the market. We have created the niche due to us being the only ones advocating for maternal mental health issues. So in terms of the weakness, it's more of the funding part. Funding is quite backwards here. And so the opportunity, we have support from the media so much, and we have that coverage, even international coverage, like even from WMI. So in terms of the threats, due to lack of enough funds, government, is not so much keen on helping us. So how do we intend to eliminate these threats? We will make sure that we liaise with the relevant policymakers. So in terms of budget-wise, we aim to have in a period of 3 years to solicit 1 million in order to, this money will be used for the monitoring and evaluation metrics to pay the counselors that we will be engaging into the day-to-day operation. We also to get equipment like cell phones in order to set up our call center, counseling call center, and the day-to-day operations like rent. In that being said, thank you very much for giving me this opportunity.
Thank you very much, Portia, for such presentation, timely presentation. At this point, allow me to welcome our next presenter, Second Chance. Charlotte, if you're ready. Charlotte, can you hear? Can you hear me? Can you hear us?
I'm trying to share my screen.
Okay, that's fine.
Oh, it's a little bit difficult to share my screen. I regret that, but I will just present.
That's fine. Please proceed.
Okay. Good afternoon, dear listeners. Good afternoon, dear listeners from Cameroon. I'm called Charlotte B, and I'm a nurse by profession. I am here to talk to you about my idea of a new CBO entitled Second Chance. This CBO will be located in the northwest region of Cameroon, and the inhabitants of Ndop are experiencing a double crisis, the COVID-19 pandemic and the socio-political crisis of the northwest and southwest region of this country. It has been realized that almost half of the young girls consulting at the health center where I practice are unable to read and write. Most of these girls find it difficult to pay for their bills. Some of these girls who are victims of unwanted pregnancies, sexual violence, are often abandoned by their families. These young girls cannot even afford for the nutritional needs of their children, talk less of continuing their education. It is with this background that the idea of my CBO, Second Chance, was birthed, whose mission is to care, educate, and transform the lives of young women and their children. In order to properly walk through this CBO, a need assessment was conducted, and the following problems were identified. And just to emphasize that the need assessment was done through interview with the young girls and some community health workers. The needs identified were lack of access to basic health quality services, lack of proper nutrition for children of single mothers, and high level of illiteracy. In order to address these problems, the following goals were set. For the short-term goals, we had the idea of subsidizing healthcare services of young girls and single mothers, assist in providing nutritional needs to children aged 5 and below of single mothers, send young girls to school. For the long term, we hope to provide access to quality health, to reduce malnutrition and improve child health, and to reduce the rate of illiteracy. In order to attain these goals, some specific objectives were set. For the short term, we had subsidized the bills of 20 young girls and feed at least 90 children every trimester. Sponsor at least 10 girls to school every year, carry out outreach activity every month. And then for the long-term goals, we had subsidized hospital bills of at least 500 girls in 5 years, sponsor 50 girls in 5 years, and support the proper nutrition of at least 1,800 children in 5 years. For the SWOT analysis of this CBO, the strength we have is that we have already had people who are willing, enthusiastic, committed, and hardworking. For our weakness, we have limited funds, and for the opportunities that we have the health center, which is ready to partner with us, and schools. We are equally having the opportunity of working with WMI. For the threats, we have the socio-political crisis of Cameroon and the COVID-19 pandemic. In order to mitigate the threat, during outreach consultation, we will try to practice the recommendations to prevent COVID-19 by WHO. For the human resource, we will have a project manager, a medical doctor, 2 nurses, a secretary, an accountant, and 2 community health workers. Our services are going to be very unique in the sense that we will offer holistic care. We will be focused on young girls realizing their dreams, and we are going to have that special touch that each of our clients coming to us will love to come back, and we'll provide our young girls with stars to shine in the future. For our budget, the annual budget has been estimated at 5,000 $126, and income will come from savings, funders, income generating activities, while expenses will be on health costs, school fees, nutritional needs of children, and motivation to volunteers, transportation, communication, and office costs. The budget has been detailed out in a table explaining the income and the expenditures. For the measurement and evaluation, we are going to have registers, pictures, testimonies. We'll have our partners, and we'll have beneficiaries who will be willing to testify. And I just wish to call on us all listening to me that we join our hands together and give a second chance to these children and these young girls who are living in abject poverty. Let's provide them with stars of good health, education, nutrition, so that they can shine in the future. Thanks for listening.
Thank you. Thank you very much, Charlotte. Thank you. Thank you. Thank you. I think we are now welcoming our last presenter, Alexander, to make a presentation on possible groups. Alexander, can you hear us?
Starting. Okay. Hello.
Hello?
Hello.
Yes, Alexander, we can hear you. Please proceed.
Okay. Okay. Please permit me to share my screen. Okay. All right. My name is Alexander from Ghana, and then all protocols are duly observed. All protocols are
unmute one. Can you please, Alex, please unmute one of the devices so that now we are able to hear you clearly? Thank you. So you can proceed with the other.
Hello. I hope it's now okay.
It's clear if you unmute the other. If you mute the other and unmute the one.
All right. Okay. No voice. I hope it's okay, please.
It's okay now. Please proceed.
Let's do. All right. Forgive me, please. Once again, my name is Alexander from Ghana, and then I'm here representing the possible groups, which is a non-governmental organization, and it was being established in the year 2018 upon the analysis that we conducted. Now, possible groups is currently carried out within the University of Cape Coast campus, which is UCC in short. So when I use UCC, I mean University of Cape Coast, and then that is where I currently stay. And then we have a plan of extending it to other campuses, but we have not actually reached there yet. But that is the plan that we have now, and then that is how it is. And our focus is on the publication of reading materials for level 100, let me say freshers only. Yes, for the past, let me say since 2018, we have been publishing books, let me say user-friendly books for business-related programs in order to assist only the fresh students, that is the level 100 students, for them to able to pursue their academic career in level 100, their stay in level 100 successfully. And then our mission, the mission has always been the best, like trying to be the best publishers of user-friendly educational materials at a lower cost. So that is what we have been trying to produce. Now, concerning the need assessment, I have written a lot here, but I'm paraphrasing them. Concerning the need assessment, I got an opportunity to witness, let me say, 2 consecutive times orientation that was being conducted for freshers. And then there was one statement that I constantly heard from the people who were conducting the orientation. And that was in level 100 or being a fresher, 80% of the academic activity depends on you. And then 20% depends on the lecturers. So when I heard the 80%, I was very shocked. And I said, wow, so 80% depends on the students, and then 20% depends on the lecturers. But comparing it with the senior high school and the junior high school, of which we have spent so many years over there, the academic institution is so friendly in such a way that you can easily talk to your teachers and then or your facilitators anytime that you want. Sometimes you can even call them when you are in the house and then you are doing an assignment and you don't understand. So I was very shocked with the 80%. So that called for my attention of conducting the need assessment. What is the response of the students? So I started with those who were in level 400. When they were in level 100, sent some of the audits that they went through and the result that they came up with. And then from the level 300, and the conclusion was that in level 100, most of them, their CGPAs got, like, let me say, were jeopardized when they were in level 100. So they need to assist the level 100s became so crucial. And then I had wanted to do it for, like the team, we had wanted to do it for the whole level 100, but we are limited in knowledge. Our knowledge is only centered on the business-related programs. So our goal is to publish user-friendly course manuals, let me say books, and the objective is to publish more user-friendly course manual and reading materials or books to first year in Cont'd, which is fresh students in the University of Cape Coast campus, in order to aid them in their 80% portion of the 100% academic work. So that is our objective. And then we have unique future. The unique future is that all the team members belong to a professional body. Myself, who is the CEO, I belong to ACC, Association of Certified Chartered Accountants. And then the finance officer belongs to CIMA, Chartered Institute of, belongs to ICAG, sorry. The finance officer belongs to ICAG, Institute of Chartered Accountant, Ghana. And then the human resource and the marketing belongs to the Chartered Institute of Management Accountant, that is CIMA. So that's the unique future. Now tackling the product, as earlier stated, we are dealing with publication of books. And then our book is, let me say, is special from that of the one in the market because our own follow systematic examples with solutions, OBJs, let me say multiple choice questions, that is what I mean, past questions, all practical questions, everything with answers. So it moves with the trend, the current trend, the course outline that has been structured in the school. So that is how it is. And then the SWOT analysis, the strength is the strength that we capitalize on is the publication, like the systematic approach and the systematic arrangement and the explanation of our book. That is the strength of our book. And the weakness is the registration. We have not yet registered the book. And then the opportunity is that initially we were competing with the lecturers because the lecturers were also publishing books. But per the new regulation that has been enacted, the lecturers are prohibited from selling books to the student. Rather, they are allowed to refer. So as a head of Students Academic Affairs who just handed over my position, we agitated vigorously against that, because the lecturers were imposing their books on the students and they were not allowing the students to buy books that will assist them. So, but the threat is that once the business has not yet been registered, we are afraid that we'll be punished by the legalities in the country. So that is the threat that we have now. Now, when you look at the human resource, the structure, we have the CEO, that is myself. I'm a member of ACCA, and then the finance officer, ICA, Institute of Chartered Accountant, and then we have the project manager who makes sure that things are moving in like in accordance with what we have planned, and then we have the human resource manager bringing in more volunteers and then people for them to help us, and then we have the marketing manager too. So these are the structures of our human resource. Now, our marketing strategy is that before the semester begins, we use flyers. We design flyers. I have a copy of some of the books here, and also we do like we design the copies of the book, like we design the covers of the book, and we make sure to circulate them on the WhatsApp platforms of the various programs that we are going to engage. So the covers, we circulate the covers on the platform for them to know the book that they will be using when they come to campus. And then aside that one too, we also make good use of flyers, and for them also to get to know that there are some books that will be helping them when they come to school. Okay. Now the measurement and the evaluation, end of every 3 days. That is, at the end of every 3 days, we make sure to have a meeting, and then we measure the performance against the actual in order to make some corrections when there is a need to do corrections. So that is how it is. So once again, the name is Alexander from Ghana. Thank you.
Thank you, Alexander. Thank you very much for the presentation. Ladies and gentlemen, you've had all our presenters right now. Because of time, I would like to prompt.
Hello.
Hello. I would like to prompt Nicole so that the poll can be opened. For all of us to give our voices before we welcome our judges to give their brief remarks. So please take your time based on what you had to vote for the pitch, that you believe was most thorough, on the business side. So we've got the business side and we've got the CBO side. So pick the pitch that you feel that was the most thorough. And then on number 2, you also vote you select, the CBO or NGO pitch that you believe also was the most thorough. And as mentioned, the summary results of the polls will be provided to all the judges. We are giving 1 more minute for voting. 1 more minute for voting. We are 41 participants. No, you don't write in the chat. I tend to think that you click. There will be a pop-up, for you to vote. 11 people have voted so far. 14 people have voted so far. please take your time and vote. It will be nice to recognize the higher, in fact, the percentage of number of people, 16 have voted so far. We have 34 attendees. Please have your voice count. $18 have voted so far. If you're in the attendees list, you can vote. The presenters, if you like another presentation, you are free to vote. I think you've gotten an opportunity where you can vote. So you want to vote for your project, you want to vote for other projects, you only have that opportunity once. Please cast your vote. We need to be getting them as they come. How many have voted so far? 21 have voted so far. 22 have voted so far. The number keeps going. We have 34 attendees. The only people who would not be voting are the panelists because they have all areas of the assessment that they will be putting, but this vote counts. This vote will be part of the final count in determining the grand winner, of 2021 WMI Academy. So 24 voted so far. You still have an opportunity. We have 72% participating in the vote. Have the vote closed? Just waiting for the confirmation. We are closing the vote in 10 seconds. You still have a chance to put your voice in. Thank you very much for participating. Thank you very much for participating. And probably we could do a quick view of the poll is closed. The poll is now closed, and it would be nice if we can share the quick result. Are you able to see the result, all participants and panelists? It should be on the screen. Again, in terms of the audience vote, select the best business pitch, all things fertility, tops the list. In terms of, the best NGO pitch, we have, Postnatal Mental Health Society of Botswana taking the lead. Thank you very much for the public vote. At this point, I would request that we stop sharing the screen. These results will be shared with the panels and the judges. And at this point, allow me to welcome our judges to give their comments. So if I can have our judges' cameras on, please, so that we can get some quick feedback, based on what stood out, general observations on what stood out from the presentations, so if we could have cameras on, our judges. So probably we can have Ernest go first.
All right, where's everyone else at?
Thank you.
There you go. So first of all, I thought that was well done. Congratulations to the both of you for leading this effort. Very difficult challenge, I think, that these scholars were presented with, given 5 minutes. I think all of their causes were very worthy, but it was definitely very challenging. It's funny, there were two in particular that I thought were definitely in the top two in terms of how I saw them, how I viewed them based on presentation and the cause itself. Definitely all things fertility was one of them. And the other one for me that was graded the highest in terms of presentation, business model, and answering pretty much a lot of the questions that was posted here on the survey was youth engaged in anthropology. I think out of all of the presenters, he probably did one of the best jobs in terms of hitting on all of the points that we were looking for. So again, extremely difficult. I thought it was a tough challenge that these scholars were presented with, but they all did a really good job, in my opinion, and that's just my observation. I also think Family and Communication Trust International, Clifton, did a good job in presenting as well. And so those were the three that really stood out to me the most out of the presenters we had. And obviously I feel bad for the folks that had some challenges with their internet connectivity. It just goes to show you we're still in need of supporting and helping that kind of challenge be resolved outside of the US. And so just my thoughts. So thank you for the opportunity, guys.
Thank you very much. For sharing your perspective. At this point, allow me to welcome Salome Asena, probably to also share some quick highlights on the general presentation, what stood out, for you. The presenters would be glad, to hear from you. Salome.
Thank you, Ines. First of all, well done to all the presenters. That was a very, very good job. So, yay, very good to hear your stories, your passion, your confidence, clarity of different points. Also in the systematic flow of presentation. Like Ernest has said, we do feel sorry for those who've had internet challenges, but we do understand and we'll base our scores based on what was shared. The three businesses that stood out was one done by Abdul, Clifton, and is it Wansai or Onsai? They clearly articulated their business components, clear flow of ideas. You could, one who's not been in the business could understand what they were trying to present and what they were trying to preach. But after all is said and done, we wish everyone the very best and everyone is a winner. So kudos.
Yeah, thank you very much, Salome. At this point, I would want to welcome, Apollon, just to give, his remarks. And while that is happening, Didier, if you are ready, whoever is ready can go first. Thank you.
Okay, are we here? Do you hear me?
Yes, we are here. We can hear you, Apollon. You can proceed.
Very good. I thank the presentators very much. I think they all did a great job. It's unfortunate that we could not hear properly and they could not get access to really sell their cases. As far as I am concerned, there are three presentations that struck me. The youth engaged in apitherapy is one, and the Community Growth Foundation by Abdul is the second one, and the Family and Communication Trust is the third one. I think they're all presented well, but maybe if we are doing a second round of this, we need to maybe give them some much more time to grasp the 11 lines that we want them to focus on. That's it for my comments.
Thank you very much. And I believe presenters are taking note on very objective feedback that are coming. And please also note that you'll be getting formal response on your projects. At this point, allow me to welcome Didier to make his remarks on the overall presentations today.
Ines, as liaison with the board members, Didier had informed us that he had to leave before he was going to be able to give the general remarks at this point. So he's not on right now, but he will be submitting his individual scoring sheets, and we'll get his feedback from him that way.
Thank you very much. And all the presenters will now have the opportunity, to hear from all the judges. So thank you so much. All this feedback are supposed to help us in terms of high-level highlight, but the detailed response will come. And of course, together with the audience vote, will determine who the prize winner will be, and we'll basically continue the engagement. So at this point, allow me to welcome Nicole to take the stage and discuss the next steps.
All right, thank you, Ines. Thank you everyone for attending today, for participating in judging and providing feedback. If you are a student scholar, thank you for coming to learn about the WMI Online Academy. Thank you to Academy participants who came to support your fellow presenters. And lastly, thank you to all who took the risk to be a presenter today. In closing, we would like to congratulate everyone who participated in the Academy for making it through our 8 weeks. We know that it has been a lengthy 8 weeks with lots of topics covered, and we appreciate your full participation. We will be announcing the official grand prize winner on Wednesday, November 3rd. We are not announcing the winner today because, as you heard from our judges' feedback and also the polling of the audience, that there is some more discussion and review of the scoring to be done in order to determine which one presentation was the most thorough in presenting an idea for either a business, a CBO, or an NGO. So please stay tuned. We will be announcing the winner Wednesday, November 3rd. And we give, once again, a grand round of applause for everyone who's participated in the many different forms of participation this year. So with that, I will be closing out our final session. Thank you, everyone. Thank you to our board members who joined us for these 2 hours, and also a special thank you to Ines and Salome for a fantastic closeout of week 8. So thank you, everyone. Congratulations.
Bye.
And great job today.
Thank you, everyone.
Bye, thank you.
Nice
Bye-bye.
weekend. Bye for now.